All right, we might just make a start. Hi, everybody, and thank you for joining me today for our webinar on supporting healthy sleep for those living with dementia. I would like to start by acknowledging the traditional custodians of the land we are meeting on today and pay my respect to their elders past, present, and emerging. I extend that respect to Aboriginal and Torres Strait Islander people joining us today. For those of you that I haven't met, my name is Laura Crowther, and I'm one of the senior OTs at Empower Healthcare. I'm based in the Brisbane office in Queensland. I have been an OT for almost 20 years. I trained in Scotland, where I worked for 7 years in the community, and then I moved out to Australia, where I've been working for the past 12 years in a variety of different settings. But throughout my career, I've worked with people in the aging community and those with dementia. Empower Healthcare, we're a multidisciplinary team offering allied health supports to the community nationwide. We do in-person and we do telehealth as well. At the moment, it's dietetics, OT, physio, and speech pathology. So what are we here for today? So in today's webinar, we're going to cover the importance of sleep for everyone. We're going to have a look at how dementia changes sleep and some common sleep problems. We will consider the role of the carer and how carers can help people. We will explore some easy ways to improve sleep. We'll look at some strategies and activities that we can try, including some helpful sleep tools. We'll discuss when to get extra help and how OTs can help. There will be time for questions at the end, so if you want to just pop a question in the chat, we'll get to that at the end of the slideshow. All right, so occupational therapists, who are we? What do we do? So as OTs, we consider the individual. We look at their interests, their roles, environments, any limitations that individuals have, whether that be physical, cognitive, psychological. And we usually visit clients at home, or we certainly do mainly at Empower. And we're looking to keep people in the community safer and more independently for longer. We do like a full assessment of the individual, and we'll look to see if there's any supports or strategies that they need to help them remain living at home and engaging in the activities and roles that they wish to do. And that's often looking at equipment, any home modifications to make it safer for them, and often any strategies or tools that we can provide, any care education. There's a whole variety of what we do, which we'll get into a bit more. So why is sleep so important for all of us? So diet, sleep, and exercise are considered the three main pillars of health. And I'm sure you've seen diet and exercise get a lot of attention, but sleep problems, they tend to fall under the radar. But they're so common, and a lack of sleep can be problematic to all of us. But for those with health concerns, it can be quite detrimental. So 3 in 4 older Australians experience disrupted sleep, and in residential aged care, the numbers are even higher. So why is sleep so important? Good sleep helps us feel better. It helps us stay calmer, more active. We have more motivation. We're more productive. We usually eat better. We're more active and exercise. So it's vital for our cognitive and emotional well-being, and it plays a really crucial role in our brain health. It helps us feel better, more active. And I know myself that if I've had a terrible night's sleep, I'm not as productive, I'm not as motivated, I don't eat as well. So if I have a good night's sleep, I'm a lot more productive, more engaged. Why is sleep hard for people with dementia? So the brain typically tends to shrink in line with aging, but with dementia, there's some abnormal brain changes that happen, which make some brain functions harder to complete. Um, Primarily memory, thinking, daily function, motivation. So this can make it difficult for people to fall asleep. They wake up more often, they get a bit more confused at night, sleep more during the day. So this can lead to confusion and a lot of sleep disturbances. So whilst increased wakefulness and lighter sleep, they're a really common part of aging, dementia actually disrupts our brain's ability to regulate that our body's internal clock, which they call the circadian rhythm. And this results in problems like waking up early in the morning, fragmented sleep, waking up during the night, being disorientated. So within the brain, dementia reduces the production of melatonin, which is classed as a sleep hormone, and that's what confuses the body's internal clock. And then poor sleep makes the symptoms of dementia worse, causing more confusion, more frustration. People aren't sure what time of the day it is. Anxiety increases, so they become more confused and often more frustrated. Some of the common sleep disorders that we find with individuals with dementia are insomnia, so that's difficulty falling asleep, staying asleep, and this can be exacerbated by anxiety, pain, lack of inappropriate sleep cues. So if the lights are on, the environment's loud, increased confusion, so people becoming more confused and restless, more insecurely in the afternoon. Increased waking up during the night is a common one. And sleep apnea is really common with those with dementia. So that is when your breathing sort of cuts in and out during the night, you're not getting enough oxygen to the brain, which isn't flushing out those toxins throughout the night. So some of the factors that contribute to sleep disruption and dementia, what causes these sleep problems? So as we touched on before, there's the biological changes where dementia disrupts the sleep by reducing that melatonin production, affecting our body's internal body clock, disrupting the sleep-wake cycle, causing problems at night. People often nap and sleep through the day. There's some psychological factors, so anxiety, depression, and delusions are really common for individuals with dementia, and they often get worse at night time. So those behaviors really amplify. People become restless, paranoid, confused. Social and cognitive engagement. So that reduced ability to participate in the tasks during the day, or like reduced options and availability of tasks. We often find that individuals are living at home by themselves. Um, so that lack of social and cognitive stimulation is often quite prevalent to individuals at home. So that can lead to some changes in mood, some like low mood, agitation, sleeping more during the day, not having those activities to pace things out during the day. And people with dementia, they need more support to engage in daily tasks, which we'll come to. Noisy or bright environments, so environmental factors, an overly bright room, loud noises, an uncomfortable bed, they can all contribute to poor sleep in individuals with dementia. particularly if the individual has sleep apnea or pain, if they're in a bed that's not comfortable or supporting their needs, then that can often lead to reduced sleep. Pain, continence, they're factors that we come across quite often. Medication. So some medications make it difficult to fall asleep, particularly antipsychotics or sedatives. They interrupt the hormone production and they can disrupt our natural sleep cycle. So how can carers help? Nearly 1 in 10 Australians over the age of 65 are impacted by dementia. Facing dementia can be really overwhelming for everyone involved, carers, family. So 75% of people with dementia are still living at home thanks to friends, family, and care services. So it's really important that we support carers to support that individual to stay at home for longer. Carers often know the individuals the best and are best placed to support them. So a large part of what we do is carer education and supporting to reduce that carer stress to keep people at home for longer. So one of the things that carers can do is just learning that behavioral pattern. So looking for any sleep problems, looking for signs like restlessness. Are they getting more agitated? Are they disorientated to time during the day? Any wandering or napping too much during the day? Supporting social engagement and activity during the day can be a really beneficial way to help structure the day for the person, keep them more engaged, more stimulated. Helping identify if they're bored or understimulated and need some more sort of meaningful interaction and taking part in activities. So looking at the roles that they have, the activities that they enjoy, and how we can modify the task for the person to be engaged and have a bit more cognitive stimulation during the day. Can they exercise? Setting a routine, so the importance of going to bed and waking up at the same time every day, usually sort of factor in the day around those meal times and medications, and really trying to limit those naps to under 30 minutes to help prevent them waking up during the night. So some easy ways that we can look to improve sleep. Keeping the person active and engaged in tasks during the day, as we said. So looking at tasks within the person's capabilities. So often with the aging population, they usually have some pain, some arthritis, some other medical conditions. So if they have reduced mobility and function, how can we adapt an activity that they want to participate in? How can we adapt that so that they can participate in the task in a meaningful way? Keeping them engaged and alert is really key where we can. Avoiding too much stimulation before bed. So turning off any bright lights, keeping loud noises to a minimum an hour before sleep where possible. Keeping the bedroom comfortable, so looking at soft lighting, a quiet space, a cooler temperature is usually beneficial to promote better sleep quality and quantity, and a comfortable bed to help signal bedtime. So often any relaxing music, a dim light, and if we need to look at a more supportive bed, so if they experience a lot of pain and are up during the night, how can we provide some equipment or some modifications to the room and the environment to make it a more comfortable and welcoming space? Dimming those lights to help with that circadian rhythm within the body's internal clock. Having a familiar routine and structure, so doing the same things before bed every night can really help sleep. So getting ready for bed, making it a bit more of a routine, toilets, dressing, teeth, getting ready for bed at the same time every night can be beneficial. I am having some issues here. So some activities to help improve sleep is again just enhancing sleep through daytime activities and engagement where possible, whether that's cognitive stimulation, nature, physical activity. So spending time in nature and outdoors, fresh air and sunlight can really help to reduce anxiety, improve mood, and improve sleep. So engaging with nature often offers us those opportunities for like social connection to the wider community, a stronger sense of self, um, that increase in oxygen intake, looking to provide those benefits for physical and mental well-being. Um, and it can often reduce anxiety, agitation, and depression. Being out in nature often improves our sleep and our appetite, enhances our mood, and increases that social interaction. Some gentle exercise can we assist that person to get out and have a walk or walk around their home, getting up often for those breaks. If they have reduced mobility, can we incorporate some chair yoga, some gentle stretching, just getting that body moving, getting the oxygen flow and the blood flow going around the body where possible. And that regular low impact exercise, so like walking or stretching, it can really help with the quality of sleep. Some fun brain activities, so trying to get people cognitively engaged, puzzles, music, chatting with others. They like music. Can we incorporate that during the day? Often with people with dementia, photographs can be quite good. So can we have a bit of a memory board or some photographs as a sort of talking point to encourage that conversation? And managing those naps again, 30 minutes is the sort of window that we try and encourage people to nap within. Food and drinks matter. So nutrition and diet can have a really big impact on our sleep. Meal times are really important, as is our nutritional intake, to ensure that our bodies and our mind are adequately fueled. So trying to avoid carbohydrates and those heavier foods just before bedtime, trying to space out meals. Meals also are important in terms of medication timing, so that absorption of all the medication so that it works as best as it can. We can refer to dietitian if it's problematic. So we often find that people aren't eating enough during the day. They're not getting that nourishment that their body and mind really need. And hydration is another really important factor. So making sure that they're drinking enough water during the day, but not too much before bed, so they're not up to the toilet often. Medication can also play an important role in our sleep. So checking medications. Some medications can cause sleep problems. So those sedatives, antipsychotics, antidepressants can really impact people's sleep. So it's quite important to talk to the doctor and get those medications reviewed regularly. Are they still needing them? Are they causing some negative side effects for the person? Just really checking in with the doctor to get those medications reviewed. Are they taking their medication regularly enough? Are they taking it with food? Um, so as OTs, we generally look at the sort of a person's full daily routine in line with the carers and what they do day to day. And an important factor that we usually look at is if they have blister pack medication, is that have they been taking it? Are there any issues? Do we need to speak to someone? There's also some non-pharmacological alternatives. So relaxation activities that I touched on before, some light music, reading, and light therapy can also be helpful. Handling anxiety and nighttime worries is another important factor. So, for those individuals that their body clocks are a bit out of whack, how can we structure their day, um, and how can we help them reduce those anxieties so they're not going to bed anxious, worried? And often that's like talking to the person at the end of the day, like, this is what we did today. It's time for bed. Do you want some music on? Setting up the room for them. Um, and then just talking about what's happening tomorrow, if need be. Looking at some relaxation techniques. So there's some meditation apps. So deep breathing can be beneficial, getting that oxygen intake in to promote good sleep quality and quantity. Some soft music. And a familiar object can often help calm nerves and support relaxation. So whether that be a photograph beside the bed, um, or something of meaning that can help calm those nerves and support relaxation. So cognitive behavioral therapy is another one for insomnia, um, which is like a short, structured, evidence-based approach, helping them manage their sleep-related thoughts and behaviors, and that can often help improve sleep. And that's mainly talking through worries or changing bedtime habits before sleep. Some other helpful sleep tools can be white noise machines, which is like background noise that people can tune into and concentrate on their breathing, reducing that background noise for better sleep. Light therapy, so bright light exposure in the morning and during the day, and then dimming the light at night to help regulate that circadian rhythm and support better sleep. Orientation clocks can be really beneficial for individuals. They can be mounted on the wall or on the bedside table, and it's a clock that you can have an analog or digital format, and often it has like the day of the week, the date, and the time, and if it's AM and PM. So they can be quite useful tools for the person to tune into as a reference point to look to see what time of day it is. If they're up through the night, agitated, confused, they can be a useful prompt for the carer to say, look, it's 10 o'clock at night. Why don't we dim the lights? If you need the toilet, we can get you to the toilet, and get back to bed, have a good night's sleep for tomorrow. There's also wearable devices and apps that can track sleep patterns just to give us a better idea of, are they up a lot through the night? Are they having those sort of deep sleep to help with that oxygen production and flushing out the body toxins? When to get extra help. So it is important to remember that increased wakefulness and lighter sleep, they're normal parts of aging for all of us, but if problems persist or become concerning, it's important to talk to the doctor or any medical experts for some professional help. So that could be for a medication review, for continence review. Occupational therapists, sleep specialists, and doctors can work with the individual and the carer to give that individual personalized approach for the client. Excuse me. How can occupational therapy help? So we do offer that holistic assessment of the individual, their environment. We look at their routines, their roles, what's important to them, and what supports are available. So we help individuals with dementia and their carers by assessing their lifestyle, their health, their ability, their environment, their daily routines. We'll look at their sort of physical capabilities, their cognitive abilities, and any barriers that there might be, whether that be in physical barriers in terms of what they can do, how far they can walk, if they have reduced hand function, if the environment's limiting things. So do we need to look at ramps, rails, to help that individual? Can we offer some education to the individual and to the caregiver? We look at their routine. So what is a typical day? When do they usually go to sleep? Are they engaged in tasks throughout the day that keep them sort of physically and cognitively stimulated? Can we get them out into nature? If they enjoyed gardening, but they can't get out to their garden, can we look at incorporating that inside? So doing some seedling planting. There's lots of different ways that we can look at adapting a task to suit the person's abilities, and how we can do that to keep them engaged so that they are sort of stimulated and engaged during the day, and help sort of that regular routine to sort of shape their day so that they are tired, they're fulfilled, and ready for a good night's sleep. We do a lot of equipment, so looking at beds, if they have pain, do they need a more supportive mattress? If they have sleep apnea or lymphatic issues, lymphedema, do we need to consider those adjustable beds so we can elevate the head to help promote oxygen intake through the night so that they have good sleep quality, quantity? Can we look at orientation clocks? There's a vast variety of what we do, but every individual is completely different. So we often talk to the carers, we look at the whole team to see how we can promote sort of better sleep routine for them. At Empower, we also offer the COPE program, which is the care of older people with dementia in their environment. And that's a time-limited support program to support individuals who are living at home with dementia and their caregivers. So in conclusion, really, sleep's important to all of us. And in line with aging, um, there's a decline in our cognitive functioning. But with those with dementia, sleep really is important. So looking at how we can support those individuals, maintaining a consistent routine, optimizing the sleep environment, addressing any physical, psychological, medication-related factors, and looking to promote healthy sleep in the aging population, and particularly for those with dementia. Every individual is completely different. They have unique needs. They have different roles, and their care should be tailored to their specific symptoms and circumstances. So watching for triggers, trying to avoid caffeine and alcohol where possible, long naps, reducing loud noises and bright lights before bed, and really trying to stay patient and flexible. So everyone's different, and it's finding out what works best for each individual. And that brings us to the end. Thank you so much for attending today and for your time. This webinar is part of our Living Well with Dementia webinar series. And the next one is Creating Enabling Environments. And that is Wednesday, the 26th of November at 12:30. Thank you. Any questions? Yes, the recording will be available, and I believe it'll be on YouTube as of tomorrow. Thanks, Magella. you. Thank you so much. I get told that my accent's dampening down the longer I'm out here. Can we share the presentation? I will check with, I'm not sure.
No, we won't
The,
have the presentation, sorry, but we will put it on YouTube tomorrow. So
yeah,
there's a question in the Q&A too. Can you see that, Laura? Do you want me to read it out?
can't see it, sorry. Is it in the chat?
No, it's in the Q&A area. It
I'm new.
says,
I can only see the chat.
that's right. Sundowning is a stressful time for my client who is trying to look after his wife. Do you suggest putting her to bed earlier?
That's a really tricky one. I mean, it wouldn't hurt. I think if you're able to look at what they're doing during the day, what time they're up at, usually with sundowning, so light therapy can actually be really beneficial for individuals that have sundowning, and that is using bright light exposure to try and reset that circadian rhythm. So that's our body's internal 24-hour clock. So with dementia, because the hormones are affected so much, they often get disorientated throughout the day. So looking for those, so trying to structure the day, I suppose, to have more light in the morning, during the day, and then in the evening looking to dim those lights and really try and suppress that stimulation. And with light therapy, you can get light boxes. So I believe that that is 30 minutes exposure in front of a light box, which is quite a significant, I can't remember, I'm sorry, I'll try and find out, but the exact light that's projected. But yeah, so that can sometimes help. So yeah, looking for those cues if you can, and then looking into light therapy might be beneficial. Going to bed early could, you could run into some issues, I suppose, if they go to bed too early. That you could find that they're then waking up more during the night and getting more disorientated. So again, it's really hard to comment, but I suppose looking at that sort of 24-hour period, what time are they waking up? Are they engaged in stuff throughout the day? Can we get can we get them outside to get that oxygen intake, keeping them stimulated, pacing things throughout the day, and then trying to get that light exposure during the day, whether that's outside in nature or through some sort of artificial lighting at home if they can't get out, and then trying to suppress that in the evening.
There was another one here. You mentioned having candles in the room. Wouldn't this be an OH&S issue? I am concerned that something might go wrong with having an open flame near a client who has dementia.
Did I mention candles?
I don't know.
Yeah, can't remember mentioning candles, but if I did, yeah, that would certainly be something that you'd have to look at. I think I was thinking more along the lines of lighting. So often we'll go out to clients who are up, say continence issues, for example, they're up through the night. They get up, they turn the big light on, bright light, get up to the toilet, and then they come back to bed. And it's really hard for them to then settle back into a good night's sleep. So often we will look at some sensor lighting between their bedroom to the toilet. Can we set that up so it's sort of duller lighting, but safe for them to then get up to the toilet? I wouldn't recommend candles, so I am sorry if I mentioned that, but yeah,
I think you did say orientation lighting.
orientation lighting. So yeah, so those orientation clocks can be good. The wall clocks, you can get those lit up. That can
Do
also
they
be a
just
big.
stick on a wall or do they need to be not plumbed in, electric in, or are they
Most
batteries, or how do they attach to the wall?
There's a few different ones. So there's batteries, or you can have like a rechargeable cord. So some of them need to be plugged in, and some of them run on batteries.
Right.
And then they flip over, like the analog ones sort of flip over. You do hear that little clunk. Whereas the watch face, am I getting confused? Analog and digital. Yeah, so the watch face one is usually more preferable, but it's harder to process. A lot of people like those flip ones that are like the digital time, and then they have AM and PM on them. But yeah, so most people sort of plug them in, mount them to the wall, or they have them on like a bedside table. Some people have them like out in the lounge area where they are through the day, and then they'll have another one in their room overnight. You can also get like talking ones that you can touch, and it'll tell you the time. Again, I mean, there's so much out there nowadays. It's knowing what to find. So again, that comes back to looking at the individual, what the issues are, and is there some equipment or some modifications that we can make to the environment to support them better.
Some people are saying I have placed a sensor light for my dad and it works amazingly. My dad's one uses batteries or can be used with electricity. Placed in a position where he gets out of bed if it goes on. Yeah, sensor lights. Very good.
And so lights are great, and you can get them at Bunnings. Bunnings have pretty good ones. And again, you can either have them battery and rechargeable. There's a lot of options. You can have touch light ones, but the best ones are like little strobe strip ones that you can put on like the skirting of the floor and just find in places throughout that sort of pathway from the bedroom to the toilet that helps reduce the risk of falls. A lot of the high-low beds now actually come with a setting that has like a light under the bed as well, which can be quite good for through the night.
Fantastic. I will stop the recording.
Oh, I'll come back. All right, I can't see any more questions. Is there